I'm Richard O'Connor. I'm Associate Professor of Oncology in the Department of Health Behavior at Roswell Park Cancer Institute in Buffalo, New York. The study that we've done looks at the prevalence of electronic cigarettes in four large English-speaking countries: the United States, United Kingdom, Canada, and Australia. Electronic cigarettes are a broad class of devices that are designed to deliver nicotine in a vapor form as opposed to a smoke. A heating element will vaporize a solution that contains nicotine, glycerin, or propylene glycol as a carrier, and flavorants and other ingredients contained in a cartridge. And the overall device is shaped to look roughly like a cigarette. Some look more like cigarettes than others. Clearly, the key to all tobacco use is the delivery of nicotine, which is the primary addictive component. So electronic cigarettes deliver nicotine in varying doses. A number of studies suggest that the amount of nicotine delivered by e-cigarettes varies widely from product to product, which gets back to the questions related to regulation and product labeling. In general, the idea is that you're trying to deliver nicotine so that you can mimic some of the hand-to-mouth action and the sort of feeling of being surrounded by smoke. So two schools of thought related to electronic cigarettes in the tobacco control movement. One is that electronic cigarettes could be good for public health if they displace large numbers of smokers away from cigarettes onto a cleaner form of nicotine delivery. The other school of thought suggests that electronic cigarettes could be harmful to public health in that they may attract non-users of cigarettes into nicotine addiction, and then from there they may move on to more hazardous forms of nicotine. It may also perpetuate nicotine addiction in current smokers, allowing them to continue smoking. For example, dealing with restrictions on smoking in public places or on airplanes, things that may have driven people to quit in prior times. ITC surveys provide a really nice framework for doing these kinds of studies because they've been in the field for a long time. You have these four countries that are broadly similar in terms of culture, in terms of language, but have very different approaches to tobacco control policy, and so it allows these natural experiments to occur. In this context, we have two countries where electronic cigarettes are legal and two where they are not, and that allows us to look at potential influence of regulatory policy in awareness and trial of these products. The sampling frame is current smokers selected and recruited through random digit dial telephone interviews. Some follow-up surveys were also conducted via the web, but the initial recruitment was done via the telephone. In all, we had 5,939 respondents across the four countries.
Do you now smoke cigarettes?
So in addition to the standard battery of questions related to tobacco use and dependence, reactions to policy measures, and intentions to quit smoking, we also asked questions in this wave about awareness of electronic cigarettes. There was substantial difference in awareness of e-cigarettes by country, highest in the United States at 73%, lowest in Australia at 20%. We also looked at this in the context of quitting. 85% of current electronic cigarette users stated that they used ENDS or electronic cigarettes as a tool to help them quit. Interestingly, non-daily smokers had nearly 2 times greater odds of reporting ever use of electronic cigarettes compared to daily smokers. Ultimately, the regulatory question is whether electronic cigarettes will be permitted on the market and be permitted to make claims about relative health risk compared to cigarettes. If regulatory authorities such as the Food and Drug Administration were to permit such claims and manufacturers could bring forth credible evidence that the products are in fact less hazardous, would not be appreciably taken up by non-smokers or youth, then the overall public health effects could be beneficial. in that it could displace smokers away from cigarettes. I think right now the data are being accumulated to make those judgments.